Hi, my name is Esther Kuria. I'm based at Njoro AIC. I'm welcoming you to another session. Last time in our session, we looked at how we can show genuine empathy to our loved ones, to our friends, when they are going through loss, grief, and bereavement. And we looked at how we can show genuine empathy. Today we are going to look at a very important thing that is key to most of us or all of us at this time of the COVID-19 pandemic, about mental health during the COVID-19 pandemic. We are all aware that 2020 has not had the flow that most of us anticipated. The COVID pandemic left most people in the world shaken, full of anxiety and depressed. And unexpected things would turn the way they have. The whole world is in distress. No one has been left out. And all of this is becoming a mouthful for us to digest at once. This therefore leads most of us to experience traumatic episodes and adapting to the new normal of how we are supposed to socialize with one another, like keeping social distance, staying at home, is obviously increasing the pressure, and this is definitely leads to anxiety. So many people have lost their loved ones, and the worst thing is that they are not able to give them a decent send-off the way we were used to, because of the situation, how threatening the disease is. This can be traumatic, and we are asking these families, it's good that they seek for counseling services because of this traumatic experience that they are going through. People have also lost jobs. Many people have lost jobs, and this is the main reason why many people are stressed, because they are worried. They are asking, how do I provide for my family? And how are we going to survive during this pandemic? And also the stringent measures that have been put in place to curb the disease are the ones that make it even hard for us. However, it's unfortunate because we do not have any other means at the end of the day. Our survival is key. Our survival is key, and it's vital. And this is the time that we should become creative, use our talents to survive and keep ourselves busy, being productive. We all have our roles to play. So we are going to look at how do we mind our health during this pandemic? How do we mind our mental health during this pandemic? And we are aware that infectious diseases like coronavirus can be worrying. This can affect your mental health. But there are many things you can do. But before we go to the many things that we can do to take care of our mental health, let's first of all ask ourselves how it might affect our mental health. How is this COVID pandemic affecting our mental health? Because it is a challenging moment for many people. And some people might find it more worrying than others. But even as we worry, it's good we remember that the medical, the scientific, and the public health experts and departments are working hard to contain the virus. So let's remember this whenever we are worried, that they are doing all they can, all the best to curb the spread of the virus. But let's also realize that most people's lives will definitely change or have changed in weeks, in months, and we don't know for how long our lives will change. But in time, let's remember that these too will pass. Some of the things that we may notice is increased anxiety. And anxiety is that unpleasant state of uneasiness, nervousness, apprehension. So we may feel, some of us may feel an increase in anxiety. You may feel depressed. You may feel stressed out, becoming irritable easily. You may feel insecure or unsettled. You may be feeling, you may be finding yourself excessively checking out for symptoms in yourself or others of the COVID-19. You may be fearing that no more aches and pains might be the virus. or having trouble sleeping or staying asleep, feeling helpless and lack of control, or having irrational thoughts. These are some of the things that we may note in ourselves. And if you're also taking prescription drugs, make sure you have them if you have had a condition, because this also may be stressful if you find yourself not having these drugs. So how do you take care of your mental health during these pandemics? Because we have already seen the signs and the symptoms. How do you take care of yourself, of your mental health during this pandemic? First and foremost, keep a realistic perspective of the situation based on facts. Keep a realistic perspective. That will be very key. And here are some of the ways that you can do this. One, stay informed. Information is power. Stay informed about the COVID-19 and the pandemic, but also set limits for the news and social media on the same issue. The constant stream and updates of news and reports about the coronavirus can cause you to feel worried. Sometimes it's difficult to separate facts from rumors. Use trustworthy and reliable sources of news. Read up-to-date factual information on the coronavirus from the right sources, like the Ministry of Health, the Center for Disease Control, CDC, or the WHO. And make sure that you don't stay so much on social media, because most of the things that maybe you can find on social media, they may be rumors, or some of the information is not reliable for you. So staying too much on social media may increase your worry and anxiety. Consider limiting how much time you spend there. And if you find that coverage on this news is intense for you, talk it through with somebody. Let somebody support you with this so that you're not overwhelmed by this news. And the second thing that you can do, apart from making yourself staying informed about the disease, keep up your healthy routines. You've had a routine, but this maybe could have been affected by the corona pandemic. But make sure at least you have a structure at this time of how you run your day. It's important to pay attention to your feelings and your needs, especially during times of stress. You may still be able to do some of the things you enjoy or find yourself enjoying or find relaxing. Some of these things may be exercising. Some people love walking, like to walk. You can walk, but make sure even as you walk, don't walk so far away from your home. Make maybe a 5-kilometer radius walk. Also, keep regular sleep patterns. Make sure your waking time and your sleeping time is regular. Maintain a healthy, balanced diet. Use relaxation techniques like breathing. Listen to yourself. Make yourself aware of your breathing. I don't know when the last time you even made yourself aware that you're breathing. Do relaxation techniques like breathing exercises. You can read a book, or you can search online exercises, concerts, or religious services, or guided tours. Improve your mood by doing something creative. For those who love craft, for those who love drawing, make sure this is the time that you will do more of those things. Like even what I'm wearing right now, this is something I've made myself. So you can do some of the things that you enjoy doing. Like craft or even drawing. Do some of those things. The third thing, stay connected to others. Whenever somebody is stressed, one may find a tendency of trying or wanting to be alone. This is not the time to be alone. Make sure that you seek support from your friends, from your family. Keep in touch with them about your life, about their lives, how they are doing. And if you need to restrict your movement, make sure, or to self-isolate, you can still stay connected through emails, social media, video calls, phone calls, text messages. You can even call people on Zoom or video call them on Zoom, several people together, and you can chat there. Remember that talking things through with someone can help lessen your worry or anxiety. They say a problem shared is half solved. The fourth thing, trying to anticipate distress and support each other. It's understandable to feel vulnerable and overwhelmed reading or hearing news about the pandemic or the outbreak. Emotional reactions during this time of crisis can appear very different from person to person. Whether you feel scared, anxious, grateful, hopeful, angry, it's all valid. It's all valid. Rather than avoid or ignore unpleasant emotion, we encourage you to pause and tune in to these feelings. Acknowledge these feelings. Remind yourself and others about the physical or the emotional ways that this pandemic is having a toll on you. The fifth thing, for those who smoke, keep off smoking and drinking. And even for those who eat for comfort, this is time to stay away from such. If you smoke and drink, try to avoid doing this any more than usual. It won't help in the long run. Eating habits can often be linked with emotions. You may turn to foods for comfort during this pandemic. Long-term comfort eating can lead to weight gain and affect your health. It's important to be able to recognize and separate your emotions from your eating. So if you find yourself like you want every other time to have a bite, make sure that you limit that, because this could lead to weight gain. Number 6, don't make assumptions. Some people are making so many assumptions and judging people of who is responsible for the spread of the disease. The coronavirus can affect anyone. It can affect anyone, irrespective of your race, age, gender, nationality, ethnicity. It doesn't. This disease does not. It doesn't. It doesn't segregate who you are. We are all together in this. Also, you can seek online help and support. Face-to-face services are limited this time because of the pandemic. Find mental health support and services that can help you during this coronavirus. During this pandemic, let us also not forget to take care of others. But also, even as you take care of others, do not suffer in silence. Make sure that you get necessary help. If you're going through any kind of violence, the rule of law is still functioning. Report any case of violence to the necessary authorities. Avoid information that can cause panic for you or even others. If you are using mental health services for an existing mental health condition, please, this is the time. If you find yourself overwhelmed, make sure you call. Also, don't stop taking medication. If you have been on medication, don't stop taking medication. But continue, but fill this with support from your either psychiatrist. If you have been going through counseling, continue, or psychotherapy, continue with your sessions. Limit your news intake, and also practice relaxation techniques. This is also a time to show support to others. Show support. Our frontline soldiers, who are our nurses and doctors, are having a difficult time adjusting to the COVID pandemic. They are working day and night. Let's remember that they are husbands, they are wives, they are children, they have families. And it's time also that we take care of them. They can also get overwhelmed, they can get depressed. Let's take care of them. Most importantly, let's be mindful of them. Let's show them moral support by taking care of ourselves and making sure that the numbers do not overwhelm them. Let's also remember that you are also your brother's keeper during this COVID pandemic. If you have a neighbor or a relative or somebody around you who need your help in maybe food supply, let's not leave others to go hungry at this time. It's also time to show support to them. So thank you very much for having listened to this session. And if you have any queries, if you have a need, call us. Our numbers will be on your screen. Don't suffer alone. We are there for you. So you can call us. Thank you very much, and God bless you.